Yeah, so on that topic, like, can you discuss any specific cases where your chiropractic care practice like significantly improve a patient's health?
So I had a lady who saw me during Christmas holidays, and Christmas holidays is not usually a time where you get a lot of new patients coming through the door because most people are on holidays. But she asked to see me right away, and the reason why is because she's been having back pain for the past maybe 2 months or so, and then she saw a Chinese doctor, physiotherapist, other chiropractors, um, massage, and sometimes it would help with the back pain, sometimes it wouldn't, and she couldn't figure out. She was recommended by someone else to just try and figure out like what the heck is going on, because she's had treatment, she's had acupuncture, you know she's done exercises, she's done pretty much everything at the book, but at nighttime she still gets like unrelenting pain where it wakes her up and she can't go back to sleep, and it's just gotten to a point where she can't really take it anymore, and no one seems to know what's going on. Had her on the table. Anytime someone has seen so many different people, especially in a short period of time, it's it kind of raises a little bit of a flag, especially if when I ask what did these people do,
Right,
and they've all done things that that I probably would have done in the past,
right.
or I would have done for if I was the first person that saw the person. So now I know, like, something sounds a little bit off. So I had her on the table, examining her back, and I noticed that how come on this right side, like just underneath at the lower part of the rib cage, the skin feels really hot. And
Mm.
it's December, so it shouldn't be hot. It's nice.
Winter.
Generally in Hong Kong, it's nice and cool. So comparing to the left side was normal temperature. So I poked around the different muscles, the different joints in the area. Does this hurt? Does this hurt? Does this hurt? And then nothing in terms of like the muscles and the joints actually hurt. So if there's no musculoskeletal component to pain, if I can't reproduce the pain by, moving around in certain positions or pushing different things, um, and then I have an idea that, what, maybe this is not like a muscle and joint problem. So I sent her right away to see her a GP who was open at the time, and to get a blood test. With the blood test, you can see things such as like in terms of like red blood cells, white blood cells, different things, and there are different markers in the body that may be elevated. So it ended up coming back to me the next day that her white blood cells, which is like your inflammatory markers, were like way through the roof. So I said, okay, like this is not normal, and there is something happening, some type of reaction that's happening in your body. We have to figure out what it is. So she went to a specialist next. So I think it was a spine specialist, and then they just did an MRI of her spine, and then what they found was actually a tumor, the size of a golf ball that was right beside her spinal cord.
That's crazy.
Yeah. So that's like in terms of like chiropractic care, I actually didn't do any treatment on her. It was just the assessment and trying to figure out kind of putting the pieces of the puzzle together so that she can so that finally finds out what's wrong with her.
A lot of problem solving involved.
Yeah,
Yeah.
yeah. So I think a week later, she ended up getting a second opinion from another doctor, and then they went in, and then they just surgically removed the tumor. It wasn't cancerous. It was just there and pressing on her spine. And
Right.
after that, she's fine. I think a year later, she had her second baby. So yeah, things were okay.
Yeah, fortunately, like it got cured like on time. Yeah.
Yeah, yeah, definitely. So I think that's why, in terms of like education wise, like you still, even though 90% of the patients will just be muscle and bone stuff, these people do show up every once in a while, and you have to know, you know, am I going to waste 10 sessions on her or 10 weeks on her to try
Yeah.
and fix this back pain, or is this something that's more serious, and I don't need to see her and she needs to see someone else?
And I
That's
love
where.
that example because like it didn't involve any like bone cracking. Like most people will actually perceive like, the chiropractic care profession is that, like people see all this like bone cracking videos on Instagram, on YouTube, and they think that's what chiropractic care is all about. But then as you said, and like, you know, like reiterate like throughout this conversation we had, is like it's like a holistic approach, right? You have to look at the different elements, and then yeah.
Yeah.
That's awesome.